Welcome to the last session of the Leaders' Dialogue. This session focuses on the importance of adopting regional approaches for malaria elimination. The COVID-19 pandemic has starkly revealed the interconnected nature of health security within and between nations. The pandemic highlighted the extent to which weaknesses in the global health system leave us all vulnerable. This session explores how countries in the Asia Pacific region can leverage investments made in malaria elimination to strengthen regional health security and ensure better pandemic preparedness. We are grateful to Dr. Takeshi Kasai, WHO Regional Director for the Western Pacific, for taking time out to share his remarks on the successes of the region and stressing the need for reaching the unreached. Dr. Kasai has worked with WHO for half of his 30-year career in public health. As a technical officer and later director of the Division of Health Security, he was instrumental in developing and implementing the Asia Pacific Strategy for Emerging Diseases and Public Health Emergencies, which guides member states in preparing for and responding to public health emergencies. Let us hear from Dr. Kasai.
Honourable Minister of the Royal Government of Bhutan, ministers and representatives of member states, partner organizations, dear colleagues, ladies and gentlemen. It is a pleasure to participate in this year's Asia-Pacific Leaders Malaria Alliance and Asia-Pacific Malaria Elimination Networks Dialogue on Regional Collaboration for Malaria Elimination and Health Security. Malaria is a disease of global importance, and Western Pacific Regional Office is committed supporting member states' effort to avert mortality and lessen morbidity caused by the disease. An estimated 767 million people in 10 countries were at risk of malaria in the Western Pacific region in 2020. Now, let me start with some good news. I would like to celebrate the recent and outstanding milestone that was achieved in our region. Earlier this year, China was certified by WHO as malaria-free. China's certification demonstrates how countries can develop robust and evidence-based malaria program to eliminate the disease. I'm also pleased to note Malaysia's success in reporting zero indigenous non-zoonotic malaria case for over 3 consecutive years. Malaysia's effort to develop an effective system to measure the risk of malaria re-establishment through comprehensive case and vector surveillance attests to its success in reaching 0 cases. Congratulations to China and Malaysia for continued success in eliminating malaria. And I'm also pleased to report on the progress across the Greater Mekong sub-region. And with the shift from passive to active case detection at the community level, Cambodia, Lao People's Democratic Republic, and Vietnam are managing to target the people most at risk of malaria, such as forest goers, indigenous communities, and mobile and migrant populations. Reaching the unreached is one of 4 thematic priorities of the For the Future vision. This vision has guided WHO's effort to support countries bring malaria services closer to hard-to-reach populations by aligning activities with their movement patterns and interventions preferences. However, there are still several challenges. The risk of artemisinin drug resistance spread in countries in the Greater Mekong sub-region and further. Also, in some Pacific Island countries, malaria cases are increasing. The high burden is due to part to a lack of inadequate surveillance and response activities to halt transmission in the highest burden provinces. Working together with the partners, WHO is supporting Pacific Island countries to develop clear and aggressive plans to improve surveillance and response activities in efforts to mitigate the increased malaria case load and reverse the trend. We're using lessons learned from the intensified community-based approach being implemented by the Greater Mekong Sub-region countries. I shouldn't end my speech without mentioning the RTS&S malaria vaccine. We're in a dialogue with the countries in the region that are interested in using this malaria vaccine as an additional tool to control and accelerate towards elimination in high-burden areas and hard-to-reach population. But I must say, the vaccine is not a silver bullet to end malaria, and we need a vaccine plus approach. As I conclude, WHO is excited and committed to continuing a robust and lively partnership with APLMA-APMEN and its extensive network of partners, donors and others to provide technical guidance and input into efforts as part of the shared vision of achieving malaria-free region. I wish I could participate today in person, and I hope that the discussions and conversation stemming from this meeting would generate concrete and practical actions that can be directly applied across the region. Thank you for the invitations to participate in this important and timely dialogue. Thank you very much.
Thank you, Dr. Kasai. We are very honored today to hear from Senator the Honourable Zed Seselja. Honourable Minister Seselja is currently a senator for the Australian Capital Territory and was sworn in as Minister for International Development and the Pacific in December 2020. Previously, the Honourable Minister has served in different ministries, including as Assistant Minister for Social Services and Multicultural Affairs, Assistant Minister for Science, Jobs and Innovation, and Assistant Minister for Treasury and Finance, among others. We will now play his recorded remarks.
Thank you, Your Excellency Dr. Lotte Tshering, Honourable Prime Minister of the Kingdom of Bhutan, the Government of Bhutan and the Asia Pacific Leaders Malaria Alliance for your leadership in convening today's dialogue. As Australia's Minister for International Development and the Pacific, I'm pleased to be able to join ministers and distinguished delegates from across the Asia Pacific region in addressing this important forum. Australia is a proud partner and supporter of health security in the Indo-Pacific region. Since 2017, the Australian Government, through the Indo-Pacific Centre for Health Security, has invested more than $300 million in regional health security. We've forged strong links with partner governments and scientific institutions across the region and supported interventions and research across a range of disease threats of national, regional and international concern. Over the course of the COVID-19 pandemic, we've drawn on these strong foundations to provide technical and policy advice directly to partner countries, coordinate emergency health assistance and program additional funding for vaccine and diagnostic development. Our commitment to supporting vector control and eliminating malaria is long-standing. It includes our role, together with Vietnam, as a founding co-chair of the Asia Pacific Leaders Malaria Alliance in 2013, and our earlier engagement supporting the Asia Pacific Malaria Elimination Network. While the COVID-19 pandemic has elevated health security to new heights in the public consciousness, it has also provided a timely reminder that malaria must remain integral to our collective regional health security agenda. New data from the World Health Organization reveals the extent to which the COVID-19 pandemic has disrupted malaria services. There are about 14 million more cases in 2020 compared to 2019 and 69,000 more deaths. Investments that are designed principally to address malaria can also support broader disease outbreak response capabilities. Effective prevention and control of health security threats supports building of resilient health systems, which is not only good for the physical well-being of our society, but also our economic well-being. We have witnessed commendable progress towards malaria elimination in some parts of our region. Vanuatu, for example, has seen a steady decline in malaria cases and is on track for elimination before the 2030 target. But we must remain vigilant about the risk of malaria resurgence. Papua New Guinea, which saw an unprecedented decline in malaria cases between 2004 and 2014 to a prevalence of less than 1% in 2013-14 in low-lying areas, then saw this trend reversed with prevalence climbing back up to 9.5% within just 4 years. This does not mean that this trend cannot be reversed once again. Indeed, by 2019-20, malaria prevalence in PNG had dropped back to 2.1%. But continuing and sustaining a decline in malaria incidence will require ongoing commitment. Research and development remain key. Since 2013, we've invested $115 million in product development. A key breakthrough in recent years arising from these investments has been the development of tafenoquine, the first single-dose radical cure for Vivax malaria. One of the few bright spots of the COVID-19 pandemic has been the incredible advances in medical science and research. Indeed, the malaria community recently witnessed an important milestone, the recommendation of the world's first malaria vaccine by the World Health Organization after 30 years of research and development. Although the vaccine will not be a panacea, it is an important addition to the global collection of anti-malaria tools at our disposal, and an important example of the kinds of scientific advances that are possible. Although the malaria parasite itself does not discriminate, we know that some people are more at risk of malaria and of complications due to malaria than others. For example, we know that in places like Papua New Guinea and Solomon Islands, women and young children are more affected by malaria, while in the countries of the greater Mekong, young men working in the forests and border regions are typically more susceptible. Engaging with and listening to affected communities and civil society organisations is critical to make sure that new scientific innovations are designed for and taken up by those who will benefit from them the most. Under the Australian Government's Indo-Pacific Health Security Initiative, we set out to strengthen early detection capacity and support rapid, effective national and international outbreak responses. And we look forward to continuing this work to advance progress towards malaria elimination and in so doing, strengthen our collective health security. Finally, I'd like to acknowledge the efforts of the many dedicated individuals at all levels across our region who are playing their part to eliminate malaria. Let us all continue to stand strong and finish the fight to eliminate malaria from the Asia Pacific by 2030.
A multifaceted approach that demands collaboration between ministries. It is as important for foreign affairs to be liaising with the epidemiology as it is in the case of malaria, particularly to be liaising with colleagues who work in agriculture. Never before have we seen the world at a place where interdisciplinary solutions are demanded of us. And there will similarly be no pathway to malaria elimination if we do not adopt a whole of government approach. Therefore, Minister Wang Mo and I had discussed for this meeting 3 recommendations, and leading with either the adoption of a whole of government approach or a reinvigoration of these approaches, particularly in terms of a sector-wide approach within countries. Next slide, please. The second recommendation is in regards to cross-border elimination plans. We have heard this at multiple meetings. We have heard about the importance of cross-border collaboration and coordination. And again, as we are here in 2021, heading into yet another year of a global pandemic, we recognize that there is no other answer than for us to communicate across borders and to collaborate across borders. But within the sessions that we heard today, most notably from Honourable Dr. Singh as well as Honourable Dr. Didik in Indonesia. It is critical that there remain a continued commitment towards cross-border collaboration, and that commitment must emanate from the level of national leadership all the way through to subnational leadership. That commitment requires, as we heard from Dr. Singh, a constant nurturing in order to be effective. And as Dr. Didik pointed out, it is critical for that commitment to also be coordinated within countries at the national and subnational level. So when we put these two things together, a commitment to cross-border collaboration at a political level which engages leaders across countries, we will be successful in enabling an environment where we can have concrete actions linked to implementation already been discussed, drawn up, debated, and agreed upon many, many times in many fora over the years. But we increasingly recognize, particularly in light of COVID-19, that we have run out of time to discuss, and we must lead with concrete action within countries and across countries to ensure that we can effectively implement and harmonize activities at the ground level, not through the sharing of data, the ability to teach and learn from one another, and to understand what issues might be across borders. To the next slide, please. Finally, as we heard in our financing session, it is critical for us to have a very clear understanding of what it means to have sustained malaria funding. That is to say, malaria funding is complex, with this heightened interest in understanding how countries may strengthen their surveillance capacity. It's all the more important for us to understand where does the funding for malaria surveillance lie within the broader funding envelope that a country may have for surveillance. In a similar manner, as countries look to battle other vector-borne disease, what exactly is the envelope of funding required to finish the job on malaria, whether it is Vivax, falciparum, or other vectors? And a last very, very critical, I would say not asterisk, but point for us all to remember, particularly in the community of malaria advocacy, is that we must be as relentless and specific as possible in being able to articulate and unpack how funding for malaria will not only strengthen health systems, but also help us combat this pandemic and the future pandemics surely to arise, thereby creating greater programmatic efficiency in a time of diminished resources. With that, I would like to close by saying that we have many, many colleagues who were unable to join in the Leaders Dialogue as panelists, many leaders from across the region in many countries. And we know that there is a sense of urgency which cannot be lost after all that we have put into the malaria fight. We know that we still have death from malaria happening in our region. And as long as that is the case, it is a moral imperative to ensure that the malaria fight towards elimination remain alive and flame to ensure that we can reach the 2030 goal. With that, I turn it over to my honorable colleague, Dr. Tshering, the Honorable Secretary, and I'm so grateful to him and colleagues for all of their collaboration in making this meeting possible. Back to you, Amita.
Thank you, Sarthak. With this, we've come to the close of the 2021 Asia-Pacific Leaders Dialogue for Malaria Elimination. And now invite Honourable Secretary of Health, Dr. Pandup Tshering, to deliver the closing remarks. To you.
Thank you, Amita, Your Excellencies, distinguished delegates, participants, ladies and gentlemen. On behalf of the Royal Government of Bhutan and the Ministry of Health Bhutan, I wish to thank you all for your participation in today's 2021 Asia-Pacific Leaders Dialogue for Malaria Elimination. From highlighting the need for both interministerial and cross-border collaboration to a need to sustain financing for malaria elimination, even as we are confronted with conflicting priorities, we have covered much ground in just a couple of hours. It has also been particularly heartening to listen to the stories of remarkable resilience from across the region, even amidst the unprecedented challenges posed by COVID-19 pandemic. Truly, it has been our collective commitment, energy, and efforts that have averted the worst-case scenario for malaria that many feared. Honourable Foreign Minister Bhutan shared earlier today that our past experiences in malaria control have demonstrated that the last mile of elimination phase happens to be the most challenging one, and that global malaria community and national programs must reflect on the past lessons and leverage it to help overcome the current elimination hurdles. Honourable Foreign Minister also emphasized on the importance of effective cross-border collaboration and coordination between countries for joint elimination response, especially when countries are nearing the end stage of malaria elimination. Alongside all of you here today, we also stand firm to reiterate our commitment to keep up the fight towards eliminating the world's oldest pandemic from our region by 2030. While it was not possible to meet each other in person this time, we eagerly look forward to welcoming everyone to Bhutan in the near future. On behalf of the Royal Government of Bhutan and the Bhutanese people, I would like to thank APLMA and APMEN for championing the cause of malaria elimination and for keeping the issues burning even during the unprecedented time of the pandemic. We also thank you for choosing Bhutan to be your partner in co-hosting the Leaders Dialogue this year. Finally, we look forward to meeting everyone, hopefully in person in India next year for the 2022 high-level meeting. Thank you and Tashi Dilek.
Thank you, Honourable Secretary, for the closing remarks. I would like to warmly thank our distinguished guests, panelists, speakers, and moderators for sharing their rich expertise, knowledge, and ideas around how the region can stay its course to malaria elimination by 2030. I'd like to thank all our participants today for being a part of this very important dialogue and for being patient with all the technical challenges. Last but not the least, we would like to express our deep gratitude and thanks to the Ministry of Health, Royal Government of Bhutan for hosting this dialogue, and to Ministry of Health colleagues for their strong support in planning and executing this event. As we close this dialogue, we request all guests to kindly check out the virtual exhibition booth on the attendee hub, where our partners have showcased some of their incredible work in the region and beyond. We'd like to thank everyone again for joining us today. And as we enter into 2022, I wish you a happy and safe new year. Thank you. Bye-bye.